Hello and welcome back to our educational YouTube channel. This is the third part of our video series on corticosteroids. We will be focusing on the cautions and key things to remember. Corticosteroids are powerful medications that can have significant effects on the body. When used for prolonged periods, there are certain considerations and precautions that both patients and healthcare providers should be aware of. Let's delve into these important notes. In our last videos, we discussed the side effects that are associated with mineralocorticoids and glucocorticoids, but here are some highlights of the main ones to look for in cases of prolonged use of corticosteroids. First and foremost, long-term use of corticosteroid can lead to adrenal suppression. Adrenal suppression occurs because the adrenal gland usually pumps out steroid hormones. However, when giving patients steroid as a medicine, the adrenal gland decides not to do the work anymore, and the body depends on the steroid tablet. This leads to adrenal suppression. It is crucial to understand that abruptly stopping these medications can result in acute adrenal insufficiency, which can cause severe symptoms such as hypertension and can even be life-threatening. Therefore, it is essential to follow a gradual tapering plan under medical supervision when discontinuing corticosteroid. Another caution associated with long-term corticosteroid use is an increased risk of infection. However, it is important to note that this risk mainly applies to atypical infections. With that in mind, extra caution should be exercised regarding certain infection. Chickenpox susceptibility is notably increased in patients on long-term corticosteroid. Moreover, these individuals can develop sudden pneumonia or hepatitis if they contract the virus. To minimize the risk, passive immunization with varicella zoster immunoglobulin may be necessary. Additionally, patients on long-term corticosteroid therapy need to take precautions against measles. In such cases, prophylactic intramuscular immunoglobulin injections are required. If a patient on corticosteroid contracts either chickenpox or measles, it is advised to double the steroid dosage during the infected period. This adjustment aims to provide adequate suppression of the inflammatory response and mitigate potential complications. Lastly, it's important to be aware of potential psychiatric reactions associated with corticosteroid use. These can include insomnia, irritability, euphoria, and behavioral disturbances. The good news is that these reactions generally subside when the corticosteroid dose is reduced or stopped. To minimize the risk of side effects, it is crucial to use the lowest effective dose of corticosteroids for the shortest duration possible. Whenever feasible, local treatments should be favored over systemic treatments. Moreover, for inhaled steroids, it is important to rinse the mouth after use to prevent oral thrush. Now, let's talk about some contraindications that apply to all systemic corticosteroids. Patients on immunosuppressive doses of corticosteroids should avoid live virus vaccines due to the potential for decreased vaccine effectiveness. There are several important cautions to consider when using systemic corticosteroids. Pregnant or breastfeeding women should only take them if the benefits outweigh the potential risks. Monitoring for fluid retention is essential, and patients with hepatic or renal impairment, hypertension, hypothyroidism, epilepsy, congestive heart failure, or diabetes require careful monitoring during corticosteroid treatment. When children are on prolonged corticosteroid treatment, it is crucial to monitor their height and weight annually to ensure proper growth and development, as steroids can impair the bone formation process, so it impairs growth. Now, let's discuss some crucial safety information related to corticosteroid use. The MHRA advises that corticosteroid, whether administered locally or systemically, can rarely lead to a condition called central serous chorioretinopathy, which involves the fluid buildup under the retina. If a patient experiences blurred vision or other visual disturbances while undergoing corticosteroid treatment, they should report it immediately. In such cases, it is recommended to consult an ophthalmologist. Furthermore, The MHRA warns against using hydrocortisone mucoadhesive Bucor tablets off-label for adrenal insufficiency in children due to serious risks. These tablets should only be indicated for mouth ulcers and not for adrenal insufficiency. This could be due to inadequate dose or low systemic absorption to treat adrenal insufficiency. There are now two types of steroid alert cards that patients may be required to carry: an NHS steroid emergency card, the red card on the left, and a steroid treatment card, the blue card on the right. Steroid emergency cards should be issued to all patients with adrenal insufficiency and are steroid dependent. This is to support early recognition by healthcare staff and urgent treatment of adrenal crisis. This card should also be given to adults aged 16 and above with risk of adrenal insufficiency, for example, Addison's disease or surgery dependence on steroids, patients receiving joint or muscle injections with other steroid use, for example, inhaled or oral steroids, patients on prednisolone 5 mg per day or equivalent for 4 weeks or longer up to 12 months after stopping, patients using high-dose inhaled beclomethasone over 1,000 micrograms a day or fluticasone over 500 micrograms a day, patients taking over 40 mg prednisolone per day for more than a week or with repeated short courses, for example, asthma or COPD rescue treatment, and finally, patients using drug affecting CYP3A4 metabolism with steroid treatment. The steroid treatment card carries a series of instructions for the patient and informs healthcare professionals of the details of the steroid prescribed. This card should be given to patients on oral corticosteroids for periods for more than 3 weeks. If receiving more than 4 short oral courses per year, a card may be issued then. Topical and nasal steroids if considered necessary by the prescriber, including dispersible tablets used as mouth rinses and sublingual tablets for treatment of mouth ulcers. Systemic absorption may follow nasal administration, particularly if high doses are used or if treatment is prolonged. And finally, inhaled steroids. We now have an exam question for you. Which is the incorrect statement about corticosteroids? A. Corticosteroids may cause central serous chorioretinopathy and should be referred to an ophthalmologist. B. Patients who are on oral corticosteroids for more than 3 weeks should receive a steroid treatment card. C. Yellow fever vaccination can be given to a patient on high-dose regular oral corticosteroids. D. Fluid retention should be monitored regularly if a pregnant woman is taking fludrocortisone daily. And finally, E. Insomnia is a side effect from prolonged courses of oral corticosteroids. Feel free to pause the video here and think about this. The correct answer is C, which is the incorrect statement, as live vaccines are contraindicated. And that wraps up our discussion on the cautions and key things to remember when it comes to corticosteroids. Remember, it's always important to consult with your healthcare provider for personalized advice and guidance. We hope you found this video informative. Don't forget to like, share and subscribe to our channel for more educational content. And stay tuned for our next video where we'll explore another intriguing topic. You can also drop us a comment below or message on Instagram at pharmacy4 on what topics you'd like for us to cover. We regularly post exam questions and answers on our Instagram to help with your revision. See you next time!